My dad was a hammer thrower, and he always wanted me to be one, and my sister was a hammer thrower, and he coached her. Freshman year, I actually broke national records. I was on 3 U.S. teams, 2 world teams, and a Pan American team. I was like, I'm a child, I'm not gonna get cancer. Like, children don't get cancer.
Bobby was diagnosed with Ewing sarcoma. There was a tumor growing in his left femur. We found that it had spread to a number of different sites in his body. In general, pediatric cancer is rare. 15,000 to 16,000 cases in the United States each year. And of those cases, less than 3% are Ewing sarcoma.
There's about 200 kids in the U.S. that are diagnosed with this cancer.
Of those cases, only about a quarter of them have spread or metastasized at the time of diagnosis, which was the case for Bobby as well.
I was shocked when, I was diagnosed with cancer with a prognosis of less than 30% chance of survival, and to realize how rare of a strand of cancer that I had. I kind of don't really remember the moment. I don't know, I just fell into like another realm.
The treatment for an aggressive kind of cancer like Ewing sarcoma also has to be aggressive. For Bobby, we offered him the option of participating in a clinical trial that we have available here at Hasbro, specifically for these rare patients with metastatic Ewing sarcoma.
I was on 5 chemotherapies and 1 trial drug.
As part of that trial, we combine a new antibody-based treatment that hopefully is targeting the Ewing sarcoma cells specifically and working together with the chemotherapy to be able to kill more of the cancer cells. In addition, we treated Bobby's primary tumor as well as the sites where it had spread with radiation. We salvaged his entire bone, but still gave him very effective therapy to his Ewing sarcoma. And that was about 12 total months of treatment. That treatment's quite intense. It's one of the more intense treatment regimens. Bobby approached treatment the way I think he approaches most things in life, just facing it head on. And I think that really helped him as he went through.
When I was throwing, it's very easy to get caught up on distance. I'm like, oh, I want to get to 70 meters. Oh, I want to get to 75 meters. Oh, I want to get to 80 meters. The more you think about those numbers, like they're just numbers. I just looked at it like, hey, he said my survival rate was less than 30%, but okay, that's fine. I'm still gonna do what I gotta do and just take every treatment day by day and move on. I mean, that number, yeah, it's a fact, but it doesn't affect me. I'm still gonna make sure I do what I have to do and just push forward. It's only a number.
I think his mindset as a high-level athlete really allowed him to tackle the chemotherapy regimen and experience it with less side effects than we see most patients have.
Hasbro was by far the best hospital to get treatment at, especially because it was a childhood disease. My oncologist was on point with everything, and the nurses upstairs and even in clinic, especially on Hasbro 5, and they're angels, and they all genuinely care for you, and they keep in mind that you're just not a patient, like you're still a person, and it's just an awesome feeling to be around them, and they're very, very supportive. After a year of intensive chemo and treatment, it feels good to finally start my education and start throwing and competing for the University of Alabama. On the track that I'm on right now, there's no reason why I shouldn't be able to compete next year and be back to like a competitive level in Division I college athletics and actually make an attempt to be on the podium at NCAAs. And I still think I can be ready in 2020 to make a valid attempt to make the Olympic team.
The fact that he is, again, participating in track and field and throwing the hammer at a high level with aspirations of going to the Olympics is amazing. And hey, we'll take it and, hope the best each day that goes by.